Hi, welcome. Today we are going to talk about exercise physiology, a personal favorite of mine, considering that's what we do. So, your exercise physiologists are Amanda, Kelly, Jess, and Gina. We all went to school, studied exercise physiology, so our area of expertise is what happens to your body when you actually start to exercise. So we're going to kind of skim the surface today about that and kind of take you into it just so you get a good idea of what's going on and so that you feel better prepared to handle that situation. So we look forward to going through this and I hope you enjoy it and learn something. All right. All right, so the first thing we're going to talk about today are the benefits of exercise. So we know exercise is good for you, but why is it really good for you? So we'll talk about the things that it increases first. So first, it increases your overall energy levels. So that sense of well-being, that feeling good about yourself and making sure that you can carry through your day and get through all your activities that you need to do for that day. It improves your cardiovascular endurance. So when we say cardiovascular, we're talking about your heart and respiratory system. So your cardiorespiratory system kind of combined together. And endurance means over time. So with that, what that means is that you're able to carry through with this and improve your functionality through an extended period of time so that you're able to kind of feel better and do these things for at least that 30 minutes that we're asking you to do. It increases your overall muscle tone and muscle mass. So we don't want you to be weak and frail when you've been sitting in the bed if you've had a heart attack or had an exacerbation of some sort or have had bypass surgery or anything, and you're sitting in the bed in that hospital room. Your body gets weak, you waste away, you have sarcopenia happen and atrophy happen with those muscles. So those muscles get weaker. So our goal is not to make you big and strong and look like a bodybuilder, but to give you the muscle tone and the muscle mass so that you can open the door yourself, so that you can open that refrigerator door, you can hold the door for others, so that you can pick up your grandkids, so you can get down on the floor and play with your grandkids, so that you can catch yourself when if you were going to fall. So we want to give you the ability to get through daily activities in everyday life and have the strength to do those type of things. So that's our goal, and to get some tone back. Nobody wants those grandma flabby bingo arms. So we're trying to avoid those and give you some tone back. It improves your sleep quality. So exercise has been shown to be just as effective on your sleep quality as medications can be. So if you're an insomniac or something, give me a couple of weeks and we'll get you exercising and you're going to sleep a lot better because we're going to make you tired. We're going to wear your body out. We're going to use those muscles again that you haven't been using as much. And we're going to make them feel more fatigued so that you are able to sleep better. And it is the only thing proven to make a clinically significant difference in your HDL. So your HDL is your good cholesterol. So that's the one we want to be higher, above 50 or for ladies and above 60 for men. So we want to get that one up, and it's the only thing that makes a difference. There are medications out there that are designed to help, but they don't actually make a clinically significant difference in that number. So now let's talk about the decreases. So you do want things to go down sometimes. So it decreases your overall blood sugar levels. So all my diabetics out there, exercise is going to help you get better control over that blood sugar. So when you exercise, we take up that blood glucose into the body and we use it to muscles for food sources, and then you're decreasing that blood sugar. But there is a caveat. You also don't want to be too high in your blood sugar before you start because we can actually put too much into the bloodstream and cause the issue. So overall, exercise will actually bring that blood sugar down. It decreases your overall resting heart rates. So most of you guys are in about the 60s, 70s at rest, and that's perfectly normal, but you've got some medications that are designed to help with that. Our endurance athletes, they're in the 50s to 60s without medication at all. And that's because of their training effects. So as you exercise more, that resting heart rate is going to come down some. And remember, normal is 60 to 100. So as long as you're in that range, you're perfectly safe. And if you're below that a little bit, it's still okay as long as you're not having any symptoms. Decreases your overall resting blood pressure. So over time, that resting value, which is what you get when we first come into class or when you sit for a little bit, that resting value is going to decrease. Now, in the immediate sense, your blood pressure goes up, which we expect that because you're working harder. But over time, that resting value, that value that you come back down to after exercise as well, is going to come down. decreases your overall aches and pains. You guys might disagree with me on that, but that's okay. But over time, your overall body aches and pains are going to come down over time. So as you exercise more, it's going to feel better. We're getting more fluid, more stability into each of those joints, and they're going to be stronger and more supportive, and so your aches and pains are going to go down. Now, when you first start, those first 24 to 48 hours are a little painful, and that's to be expected. It's called delayed onset of muscle soreness. So what that is it means that as you exercise, we are literally pulling those muscles apart and tearing them. Well, what happens when we do that? We actually release cytokines and other enzymes into the bloodstream that cause you to feel pain in those areas. Well, that pain that you're feeling means that that muscle is working and we've done what we wanted to do. But now we've got to repair it, and by in that repair process, which happens when you're sleeping, we make it stronger. So yes, those first 24 to 48 hours, if you're doing something brand new, it's going to feel a lot worse, but then it gets better. But guess what? You're coming right back. So you'll be back in here again the next day. But we want to get you doing that on a routine basis. And as you do it routinely, those aches and pains are going to go away. That delayed onset of muscle soreness is going to go away, and you'll get used to it. For those of us that exercise regularly, if we have that body aches and pains after we've exercised, especially if we've done a hard workout, then we know we've done our job. So we know that we've gotten that workout in that we need to do, that we're getting the effect in the muscles that we want to do. So next one is your stress levels and depression symptoms. So exercise has been shown to be just as effective on stress and depression symptoms as medication is. So if you are having some depression symptoms, it is a great resource to get you out. When you go exercise, for 30 to 45 minutes, you release those happy hormones for the next 6 to 8 hours. So your 30 minutes of exercise first thing in the morning takes care of your happy hormones for the day. It is a great resource for getting out that stress level. There is nothing better than going out and pounding the pavement after you've had a hard day of work or whatever, and something is really stressing you out. The pavement is not going to beat you back. So just going out and doing that yourself can really help you make you feel a lot better. I know it's my biggest stress relief, and if I didn't exercise on a regular basis, the people around me would not be happy either. And then the biggest reason why you guys are all here is it decreases those risks of future events, which means that those events like coming into the hospital, exacerbations, future heart attacks, future stents, future bypass surgeries, anything like that, as you exercise more, you make this routine, that number is going to go down and you're going to have a better health going forward. So let's go to, all right, so we finished up with benefits. Now let's actually talk about what happens. So when you exercise, what do you start to notice that happens to your body? So you feel like, okay, so you start breathing heavier. Then your heart rate gets a little faster. Oh, and y'all's favorite, I start to sweat. Sweat's good. That's a very good thing. But have you ever had that burning sensation in those muscles, especially like in your legs when you start to first go out for your walk, or that exercise on the treadmill especially, and on the elliptical for those of you doing that, and in the quads, or when you're doing squats and you feel those quads just screaming. That's those muscles saying, hey, wake up, I'm moving down here, I need more oxygen, I need some nutrients down here, somebody send me something. So that is that increased energy demand that we're talking about here. So what that does is when you feel that sensation, it actually sends a trigger to the brain to release a hormone. And that hormones actually activate your aerobic system, which is the system in your body that uses oxygen and water to produce energy, so which is ATP. Not that you guys need to know that, but we could even draw out the whole Krebs cycle if you want, which is the actual energy breakdown of all this, but we won't get that in depth. But if you ever are interested, we can diagram that for you. So you get that increased energy demand. This is me walking, by the way. And you start to breathe harder. So that respiratory rate, which is the amount of breaths that you take per minute, actually increases, and it increases so that you're getting more oxygen. So if you're not breathing, you're not getting any oxygen in. And that way you can also blow off more CO2. So when you exercise, you're going to breathe more, so you're going to produce CO2 as a byproduct, so you got to get rid of that. Well, we got to get that oxygen moving, so the only way to get it moving is to get it through the bloodstream. So in order to do that, your heart rate has to increase too. So your heart rate's going to pound faster, and then as a result, we're going to also increase your cardiac output. So your cardiac output is actually a byproduct of your stroke volume and your heart rate. So your heart rate is how many times your heart beats per minute. Stroke volume is how much blood flow is going through your heart per minute. So at rest, we're around 5 liters per minute, which still is a lot of blood. And then when we start to exercise, we go up to 15 to 20 liters per minute. And then if you're going to the extreme exercise, you're looking at 25 to 30 liters per minute. So you can really increase that blood flow. Well, how do we get all that much more blood? Well, it actually filters in from the other rest of the part of the body, and that's actually increased fluid, which increases the blood flow that goes through the system there, so that you're able to increase that. Well, if we're putting more blood flow and more fluid into the system, what's going to happen? Your blood pressure is going to go up. So that's why we talked about earlier that as you exercise in the immediate sense, your blood pressure is going to increase. And as long as it doesn't go too high, we are perfectly okay with that. And we have our limits and everything as far as that. Actually, we will not stop you from exercising unless you cross the 210 barrier. Please don't get that high. That would not be safe at all. We'll actually hope to catch you before you get to that point, and we'll slow you down to a lower workload so that you don't get into danger zones. Well, with the increased blood flow, so that's putting extra pressure on the arteries. But then the blood flow also redistributes. So when we're at rest, we're primarily in our visceral. So the digestion and renal functions, skeletal muscles, in the bones, everything like that, just to kind of keep the body in that nice homeostasis mode. But when we start to exercise, those muscles, like I said before, where they're going, hey, I need more exercise, I need more oxygen, are screaming at you. You got to get them some blood flow. So the blood flow redistributes. So from the muscles go from 15 to 20% to 75 to 80% when you actually start to exercise. Now on this side, we actually show this distribution change. So the bottom of the slide here is rest. So you can see that, and that's around 0.75 milliliters. So this is like sleeping rest, so really at rest. And up here we're at 20 liters of exercise. So this is a pretty good intense exercise. So you're probably running about an RPE here of around 15 or so when we start to exercise. But I really want to point out some key differences here to you. So we're looking at 100% on both of them. So here we're at 5 liters per minute, and then up here it's 25 liters per minute. We're really looking at that. So the viscerals. So when you're at rest, you're at 20 to 25% at rest. So that's that digestive tract. That's why when you got to digest all your food, they don't really want you working out or exercising immediately after you eat, because all the blood flows in the belly. And so your muscles are going to cramp up because they're not getting any blood flow. But when you start to exercise, you're up here, you're at 3 to 5%. It drops significantly because of the shift to the muscles. The heart gets the same. Regardless of whatever you're doing, your heart still needs the same amount of blood flow because it has to function at all times. So your kidneys are the next one here. You're looking at 20% at rest, which is why you have to pee every time you get up in the middle of the night or in the morning. But you still have to pee when you exercise sometimes, and it's still because those kidneys are still functioning. They still have stuff to filter out. They're still working through that blood flow and everything. Your bones, which are where your blood cells and everything are produced, 3 to 5% at rest, and it drops down to like 1% when you're exercising, because we still need our bones for support structurally and everything, but they're not doing a whole lot when we actually exercise. The brain, well, it does a lot of work while you're sleeping, so about 15%. And then when we exercise, it drops to 3 to 4%. So you still have to function. I mean, we got to have some cognitive function here to be able to exercise. You got to be able to walk and talk and chew gum at the same time. Please don't chew gum on a treadmill though, or while you're exercising. Not good, especially if you're on oxygen. I want you breathing in and out your nose. So this decrease happens, but we still have to have some. You got to keep that brain functioning. Ooh, here's one of my favorite ones to look at. The skin, or the integumentary system. So at rest, it's about 4 to 5%. It still has to function. We got to get blood flow going through there. But when we start to exercise, it increases almost to 20%. We're talking about a 4-time increase there. All right. Why is that? Why do you think that happens? What's your favorite thing to do? Especially my ladies. Sweat. Your skin is your biggest cooling system. So when we sweat, when we exercise, it comes out through the skin cells. And so that's where your sweat glands are located. And so that's where your cooling system is. So when we exercise, the blood flow increases to the skin capillaries so that you can get rid of that heat, because exercise is an exothermic reaction, meaning that it gives off heat as a byproduct. So if we continue to store that heat in our internal core, our core temperature is going to go up, which will set off all sorts of alarms all over the body, and some organs will actually start to shut down. So we got to cool off the body. And so we do that by sweating. And so the sweat evaporates off our body, and as it does that, it actually brings the body temperature back down. So that's why the skin system is so important. And if you are a heavy sweater, please wear something other than cotton when you exercise. You need something that's sweat wicking and moisture wicking so that the moisture continues to evaporate off the clothing. All right, and then here's the muscles, the big one. So 15 to 20%, and then woo, 70 to 80%, 85%. When we start to exercise, those muscles really need that exercise. That's why it's so important to do. All right, one more graph, one more picture here for you. So just putting it all together. So we talked about that we're cardiorespiratory. So we work together. So you have cardiac and pulmonary rehab in the class, in the gym at the same time because they work so closely together. And this picture really demonstrates that nicely. It's a nice little flow where it shows it comes into the heart on one side and goes out the other side. So the blue in this picture is deoxygenated blood and the red is oxygenated blood. Another thing to keep in mind here, and we'll talk about it in anatomy class as well, is arteries carry blood away from the heart and veins bring blood back to the heart. So let's talk about how all this works together. So we talked about the oxygen and CO2 exchange earlier. So it all starts in the right atrium. So that's where everything kind of returns, and that's where we get started. That right atrium pumps down and comes down into the right ventricle. Once you come into the right ventricle, that right ventricle contracts, which remember the ventricles are the stronger part of the heart. So they're going to contract, and that's going to push it out and up, and it's going to go out here to the lungs on either side. So it doesn't actually look like this. It's a little closer together. But when it goes out to the lungs, it's carrying away deoxygenated blood. So your pulmonary artery is your only artery in the body that carries deoxygenated blood. And the pulmonary vein is the only vein that carries oxygenated blood. So when it goes out to the pulmonary artery, out to the lungs, it goes in the lungs and it goes out to your capillaries in the lungs that surround your alveoli. Those alveoli are thin enough and that air is thin enough that you have that gas exchange happen at that point. And so with that gas exchange, you unload the CO2 and you pick up the O2. So now you have oxygenated blood. That oxygenated blood then travels back to the heart into the left atrium. That left atrium then contracts down to the left ventricle. And then when the left ventricle, the strongest part of your heart, contracts, it is going to come out and up through the aorta, which is your big vessel that sits on top of the heart, and then out through the aorta down to the rest of your body. And that's going to go up the superior vena cava and down the inferior vena cava. So it's up and down all the way, or the artery, aorta, and then it comes back via the vena cava. So it comes up and down. So it goes out to all those peripheral arteries, goes out to the capillaries, and you at the muscles, and then you have the gas exchange happen again. So this time you're going to drop off the oxygen to those muscle cells and the brain cells and whatever else you need in the heart cells, and you're going to pick up the CO2. And that CO2 then comes back to the heart via the vena cava, which is the big vein in your body, and comes back again into the right ventricle. And the whole process starts all over again. So it's this nice cyclic pattern that we see. And so you can tell with this going on, a lot of times what we will see is our heart patients will sometimes develop lung problems, and our lung patients most often develop heart problems of some sort, because they are so closely tied together that one affects the other so strongly. So it's really important to do that. This last slide actually has a video on it that puts all of this together. So this is on our YouTube page, and it's how oxygen gets around the body. So it takes everything that we talked about today and puts it all together in a nice pretty picture. So if you guys have any questions, please let us know. Reach out to us when you're in class, send us an email, anything like that. But please do watch this video. I think it's really cute and it's very interesting. So hope you all have a great day, and we will talk to you soon. Bye-bye.